All right. Hello, guys. This is the first time you guys are seeing me. My name is Sasha Ritchie. Thank you guys so much for joining us today. Um, I am the Kinship Institute training manager here at Foster Kinship. I am a licensed social worker and a proud advocate for children in care. I'll just talk a little briefly about why I'm passionate about kinship care. I got involved with foster kinship in my earlier 20s as an intern, and I quickly just saw how important it is for kids to have that connection and stay with their families when they have to be separated from their parents. I also worked in adoption recruitment as well, which was really tough work. I used to work with a lot of youths, and they're always, a little bit more challenging to get them adopted. And so from there, I realized how important it is for families to have that nurturing connection with their caregivers, with their families, with family likes as well. If they have any family friends out there, or teachers, or counselors, or any important connection that they had prior to being separated from their parents. This next session is going to be talking all about permanency and permanency options for children in care. Trista is going to get us started, and then I will come in halfway through. I look forward to learning more from you guys, what you guys are offering in your communities, and I'll see you guys back in just a second.
All right, you guys, thank you. Welcome back. So we want to start the first part of today, just talking a little bit about the humanistic qualities of permanency, right? Like, what does this look like just at a person to person level? And then Sasha's going to come, she's going to talk to us about the statistics, some of the options for permanency, things like that. And then we'll kind of spend some time at the end talking about loss and permanency. Like, how does it impact our kids, and what are things that we think about when there's going to be a loss of permanency with a established caring adult, right? So our goals, just real quick to go over those, right? Our goal is to understand what permanency means for children in care, to examine the options available for families, to explore adoption options, learn how permanency can be associated with loss. That's that piece we'll wrap up on. Oops. So to touch on what permanency is real quick, the legal definition of permanency is when a child is able to reunify with the person whom they were removed from. If reunification isn't possible, then permanency would be achieved when the child finds a permanent living arrangement, either through adoption, guardianship, or another planned long-term living arrangement, right? And that's the legal definition. When we, are in court, or when we're talking, in our team meetings and things like that, this legal definition of permanency is what we're talking about. And in layman's terms, taking out all of the other jargon, right? Permanency is just family. It's the healthy, nurturing relationships with the people that are going to help us transition, help our kids transition into adulthood. It's the connections that we're going to have long term, right? When the department is no longer involved and young people are on their own, who is going to continue to be that ongoing support system? Whoever that is, right? Or whatever outcome the child ends up doing, regardless of what we all say and talk about and put on paper, that's the reality of their permanency situation, right? So we've got our legal definition that is, talking about, physical location, right, where the child lives, who has legal responsibility for them. And then we've got, our kind of relational permanency that talks about like those realities of what happens, right? Who are the relationships that child has after the department is no longer involved, after the courts are no longer involved, for the rest of their lives, really. The big question sometimes that we ask is, why is this important, right? Why do children need permanency? And just real quick, if you want to throw something in the chat box, please feel free, but just take a couple of moments to think about a time, maybe when you were, a child or a teenager, right? When you were in trouble and you needed somebody, right? You needed your mom, you needed your dad, you needed someone to come pick you up, or you needed advice. Maybe something simple like you needed someone to show you how to wash, do laundry, or balance a checkbook, or maybe it was those bigger things. Maybe you were somewhere and people were drinking and driving, or you didn't want to ride with somebody because it wasn't safe, right? When we're kids, sometimes we get ourselves into situations, sometimes we don't know what's going on, we don't know how to process stuff. We're growing, we're developing, we need safe adults to help us navigate that stuff. And that's why permanency is important, because trust and rapport is what is required, right, for vulnerability, right? For kids to be real honest with us about what they need to be able to trust us and to have a relationship, a connection with us. And permanency is what helps establish that. I don't build a relationship in just a day with somebody. I don't think most of you guys build relationships with children, with not children, but with people in just a day. Children don't either. They might attach more quickly because, they're, children, attachment is a huge thing for children, but to truly experience trust, to truly experience safety, right? Feeling safe, feeling like they're in a safe place, feeling like they're in a place where they can be vulnerable. That takes time. It takes consistency. The young man, my kinship placement that I have in my house, we've been building a relationship for years now. He's only lived with us for about a year. It's been a little more than a year, but that relationship, the reason that when he went into care, he's older. So the department said, do you have people that you can stay with? The reason that he gave my name in the first place is because of the time and the consistency that I spent building that relationship and being a trustworthy person and being a person that follows through and who listens without judgment, right? Who he feels like even when he really, really messed up, he can tell me. I've had young people tell me, when I talk to you, even when you're mad at me, I don't feel like you don't want me or don't want me around, right? They can feel that kind of stuff, but time and consistency builds that kind of feeling. And that's where permanency comes in. I just was kind of touching on this, but the things that we were just talking about, that's why children need permanency. Everyone needs someone, and children need those permanent connections. I am older. Told you guys earlier, I'm not going to tell you exactly how old, but I'm getting up there. I still need my support systems, right? Up until the day my mama and daddy passed away, I was at their house talking to them. We did Sunday dinners. That's who I called when I had a bad day. My daddy used to call me at 6 o'clock in the morning to ask me how the weather was 4 blocks from his house, because we lived, not too far from each other. I needed those connections. My children needed those connections. It's important for all of us, and our young people, when they can't live at home with their parents, that is already a damaged connection. So we have to work even harder to help them find other connections, or to keep some sort of strength to the connection that they have, right? If they're not living with mom and dad anymore, that's damaging to the relationship, in almost all circumstances. So, no matter whether children are going to reunify or look at another permanency goal, permanency period is a determining factor for positive outcomes. So just looking real quick, how does permanency or the lack thereof impact children? If I'm telling you that they need permanency and that this is like of utmost importance, what happens when they don't get it? There's a couple things, right? Children who do not achieve permanency, they're less likely to be able to cope with the challenges and stresses of life. They're more likely to become incarcerated or become pregnant within 12 to 24 months of exiting the foster care system. They're less likely to become employed, to pursue higher education, or to find a trade that will provide a long-term career path. When nobody ever sticks around and takes the time to teach you how to cope with hard things, you just don't. I'm sure that we all know somebody who they run away from everything, right? They don't ever really face their problems head on. They're always kind of running, and they're probably not very happy. And so it's very important for us. Permanent connections, it teaches children how to navigate, conflict, right? I get in an argument with my mom's still going to be there. I have to learn how to navigate through that conflict. I need somebody to teach me, hard stuff. Our homes are safe places to learn things like what happens when we're rude to people, right? My mom might maybe have a sarcastic comeback to me, or might say, don't talk to me like that, right? Do things to teach me how to adjust my behavior. But out in the world, somebody might want to be physically aggressive with me, or I might lose out on a job opportunity, right? So permanency provides safe places for our young people to learn all of these skills that are required to be employable, to be able to focus and pursue higher education, to be able to, be successful in trade schools, to have the coping mechanisms to not end up getting incarcerated, or, to have a high enough self-esteem, or to have the skills, right, and the knowledge to avoid, pregnancy, unplanned pregnancy. So permanency is where children learn these skills and coping mechanisms. This is and when they don't have that, they don't learn those skills, right? And they're impacted significantly by that. My 30-year-old still comes to me with life questions. Yeah, I'm older than 30. I still be calling people with life questions. I promise you, this doesn't stop, right? Sometimes I look around and I've got my 3 kiddos. I've got my kinship kiddo. I always have extra kiddos at my house. And sometimes I'm still looking for the grown up, right? I'm like, where is the adult here? And then I'm like, oh yeah, I'm the adult, so we always need people that we can consult with and who can be there for us. According to Casey Family Programs, the longer children are disconnected from permanent connections, the more likely they are to be moved multiple times, which in turn causes sustained trauma, issues with detachment, poor school performance, and behavioral issues, right? When children cannot form permanent connections, it impacts them across the board. If you've ever, I don't know if I used this analogy earlier, I use it with a lot of my classes, but if you've ever gone outside and it's real cold outside and you get cold to the point that you feel like frostbitten almost, right? That's kind of the way we start to feel when we get detached from people, when we don't get those permanent connections, right? We start to feel kind of frostbitten and our bodies start to cope with that. Then we go inside, right? We come out of the snow, we go to wash our hands in warm water and it hurts. Our body has to adjust to that. Well, it's the same thing with trauma and connections, right? When kids don't have connections, permanent connections, and they move around a lot, it's hard to focus on school. It's hard to go from having no connections in the rest of life and being in school, or having to have a job if they're a little bit older, or participate in other things where relationships and connections are required. Then, kids start to get overwhelmed. We start to see behavior issues. We start to see educational fatigue where they can't focus on school. And so this is a huge issue that's largely tied to permanency. Not always completely, but it's a significant factor. Frequent placement moves. When children are not connected with adults, we see these frequent placement moves, right? That's what I was just saying on the previous slide. This not only compounds the issue of being separated from mom and dad, but it also, like, you can also get separated from your siblings, right? The more moves you have, the less likely you are to stay with sibling groups. You're more likely to be relocated to somewhere you've never even been before, right? And you're more likely to be in places where you don't feel like you belong. My foster mom and dad, they were kinship caregivers. They were friends of my mom's. My mom was pregnant with me when she met them. I literally knew my caregivers my whole life, right? And when I was with my mom's sister, or my dad's, my foster dad's children, there was no confusion that I was the black sheep, right? That I was the odd person out, and lack of, always having to move around and be that new person and having to be that black sheep, per se, it takes a toll on you. And then kids are already developing, growing. They're supposed to be worried about like football and navigating, spats with friends and new maybe girlfriends or boyfriends or relationships, or, whatever. This stuff is really big stuff. And, lack of permanency really forces kids to really have to act like grownups long before they're ready. Children who are removed from their homes and then who experience placement disruption, this leads to them feeling distressed, a sense of loss, a sense of not belonging. And this just leads to not trusting nobody, right? If I don't feel like I belong anywhere, who can I trust? If I, mostly we build trust because we recognize traits in other people that feel safe to us, right? That's how we establish trust with people. And when we're always moving around and we don't really know what's safe, we don't know what is healthy, well, then we just feel like we don't belong anywhere. And then we don't know who we can trust. We don't know what a healthy relationship looks like. And then again, still trying to be kids on top of that, right? Really hard stuff. These are big feelings for our kids to have. Um, Placement disruptions. This can increase induced related responses, right? Earlier today, we were talking about how trauma impacts the brain. Placement disruptions, we all said that's a trauma, right? That can impact the brain. It impacts the way our brain releases those chemicals, that adrenaline, that cortisol, right? Even our dopamine levels, all of our endorphin levels, all of those things. So this can, being moved around and not having permanency can actually create alterations in the brain from the trauma that's experienced with that. Multiple placements, that increases the probability of mental health usage, right? Our young people, when they move around, this is trauma. We need help processing this stuff. So the more placements that a young person has, the more likely they are to need mental health services and resources. And the more likely they are to need more intensive services that are even harder to come by in the population, right? Lastly here, the last thing that I've got on my list, which I'm sure we can think of even more, but the last thing I have here is educational delay, right? Every time a child moves schools, it is estimated that they lose about 6 months worth of educational progress. So on average, a foster youth who does not obtain permanency moves on average 2 times a year. Well, if I move 2 times a year and I lose 6 months of educational progress every time I move, I'm always at ground zero, where I might even be going backwards, right? So then that causes me to be more stressed out, have anxiety. I'm not naive to the fact that I'm not where everybody else is around me, right? And then I have to somehow figure out how to perform. I remember being in care and having people tell me they didn't even care if I failed classes, just show up. How hard must life be that people don't even expect you to be average? They're like, it's okay, you can completely fail out, right? That is a testament to how hard these scenarios are and how big of an impact life has when our children do not achieve permanent connections, or achieve permanency, period. So kind of moving on from there, the next section is going to be talking about like what our options are for permanency when we're looking at the out-of-home care. Before I turn it back over to Sasha, does anybody have any questions, concerns, comments, any of that? I usually do thumbs up for my classes, so I almost said give me a thumbs up, but I can't see you today. So I don't see any questions come through. I'm going to go ahead and pop this back over to Sasha real quick, and she is going to continue with us on those options for permanency in the out-of-home care.
All right, guys. Hello. Let's go through permanency options for children in care. I have so many stats for us on this. So I don't know if you guys are stats people, but I love looking at the numbers of everything. So let's dive into it. First up is reunification. So reunification is very prioritized in the child welfare system. Of course, it's really important. I won't dive too much into reunification just because one of our sessions goes really in depth with reunification. So this will be just like a bit of an appetizer for us. So reunification is of course very important. And research shows that 3 out of 5 children in foster care are reunified with their family. And rightfully so. So I wanted to kind of focus on what are some resources or supports that you guys may be kind of doing in your guys' communities, in your guys' area of professionalism, your expertise on how you support reunification, how you guys support the reunification process. Go ahead and chat it out. What's the question? how we are supporting the reunification process as professionals. Family therapy, parenting classes. Nice. Parents are given service plans to complete. They are given services to help fulfill requirements of service plan, just knowing what they need to get their neat kids back. Perfect. Family therapy is so important. We're actually going to dive into this in just a little bit. We have caregiver support and parent partners. I love that. I was really hoping someone would mention that. Would love to know more about parent partners, peer support groups, therapy, parenting classes, and supervised visits. We try to make connections between caregiver, foster parent, and birth families. Awesome. Okay, so yes, we emphasize a lot on reunification. And one of the things that I like to focus on is because that emphasis is so large, what does the support look like, right? And making sure that we are meeting that big goal that we have for kids to go back to parents. So some resources that could be really beneficial to the reunification process. I looked into this, and access to treatment. This one is a huge one. Hopefully your guys' areas have more for parents to access treatment, whether it's for substance misuse or alcoholism, anything. I will say in our area, this is something that we can improve upon, right? There's a lot of kiddos that are coming into care because of substance misuse in their homes from the parents. And the more services and access to treatment for parents, the better. Of course, with treatment, it takes a long time for someone to get sober and to get stable, right? And sometimes we see kids in care and parents trying to become sober, but there's still that missing piece. There's still something missing, right? And of course, it's doing a lot of self-work as a parent. There's just a lot that goes into, understanding the disorder of substance use and addictions. Peer parent support, this ties into that parent partnering that is so important. So peer parent support should be more funded in foster families, including KINs that can be part of the helping systems. If the birth families had the support and network available to them, such as the kinship caregivers and the foster families did or have, there would be probably more successful rates of kids going back home, because we see that parents need someone who know what they're going through, right? If I were to be working with a birth parent who had been separated from their child, they're going to take probably one good look at me and know that I have no idea what they're going through, right? I can empathize as a professional, right? And I can put on my trauma-informed hat, and I can do my best to make sure that this person is wrapped in support and be that listening ear. But it's a very different experience for that parent when they have someone to walk alongside their path with them, who have gone through maybe something similar, right? Or who understand what it looks like to try and make sense of court documents, or to try and then fail, right? And then how important it is to have that encouragement to get back up and try and keep trying, right? It's so crucial for birth parents to have that support. One important thing that I always teach my caregivers is just changing our perspective on birth parents. And that alone is so crucial in the reunification process and the support that we as professionals can offer, right? Birth parents are not villains. Oftentimes, we have a lot of parents who have unresolved trauma, who are going through really complex situations, right? And it's not just due to family dysfunctions, but it could be to external factors. It could be due to adverse community experiences, as Trista covered in her trauma conversation. There's different layers as to what happens to the birth parent that has led them to be in this situation. Someone had mentioned therapy options as well, and absolutely offering therapy between the parent and the child. And I would take it as far as also, I think the family therapy between the caregiver, the kinship caregiver, and the birth parent. Sometimes in kinship care, we see that the relationship has been really affected, right? Because kinship caregivers are angry, they feel guilty, they feel shame, especially for grandparents. Grandparents often feel like, well, did I mess up somewhere along the way that my child is doing this to my grandchildren? They're harboring a lot of emotions on all sides. And when we are able to offer family therapy for them to work through their issues and combat it head on with, okay, well, let's take a look at, like, your guys' relationship. This can tie back into treatment. We know that the more support, the more emotional support the parent has, the more people they have cheering them on to get better and to access mental health services, to access treatment services for for substance misuse. Eventually, that's what's going to take them to the place of healing. Someone earlier had also mentioned assistance with resume building. Absolutely. When we take a look at the services that we offer to adolescents in foster care, one of the programs that we offer here in Nevada, which may be similar to you guys, is we have independent living workers for our kids to gear them up for the real adult world, right? I think we should offer the same things to birth parents as well. We can never assume that birth parents just know how to apply for a job or know how to put a resume together or have interview skills, right? Or know how to dress for an interview, or know how to answer questions in a professional way. Things like that can be, something that stabilizes them. That could be their last to do in order to be successful in the reunification process. Job assistance program. This one I would say is so crucial right now because the pandemic has really affected our job market, inflation, everything has been affected by the pandemic with this. And finding jobs can be a little bit more challenging right now too. I think that support groups can also be beneficial for birth parents, right? It's that extra layer of support that our families need and our birth parents need to know that, hey, you're not alone in this, right? I think that when we think about kids in foster care or parents who have a CPS case, there's a lot of stigma behind that in our community. But we also know that there's a lot of different reasons why kids come into care. It's not just substance misuse, it's also poverty, right? It's also domestic violence. There's so many different things happening for a young mom, right, who may be in a domestic violence related situation. The kids were removed due to her inability to keep the kids safe. We know if we take a look at a situation like that a little bit deeper, we're going to see that it was likely a mom who was doing her best. And we know that toxic relationships and abusive relationships are an addiction of its own. And it's really hard for survivors of domestic violence to come to the other end of that. Lastly, expanding services of the Kinship Navigator program to birth parents. So if we were to provide Kinship Navigator programs to birth parents, this would include providing services to the whole family, right? And in our model, we focus on emotional support, financial stability, and building legal capacity, right? And now if we were able to provide those same level of services to our birth parents, I'm sure the success rate would be even greater. What benefits may we see if the Navigator model expanded services to the family system? So I want you guys to brainstorm, what benefits do you guys think you'd see? Less placement disruptions. Absolutely. When we're teaching our licensing classes, we actually talk about grief and loss. We talk about being trauma informed. We talk about behavioral strategies to apply in the home with our kinship caregivers. At the very end of all of our classes, we'll have our caregivers ask if the parents are getting similar training, right? And we know that our caregiver or our birth parents have to go through parenting classes, right? But we don't, I mean, and maybe you guys do know, but like there's no guarantee that like our birth parents are getting that trauma informed training that could also be beneficial to them in their road to being reunited with their kids. Sometimes we see kids or birth parents that may not understand that it's traumatic for their kids to be in foster care, right? Especially when they're placed into a kinship home. They may think that, well, they're with their aunt or they're with their grandma. They're going to be totally fine, right? They're better off without me. And that's not the case. And I sometimes wonder if there's someone who's, beside them kind of explaining like, well, your child still loves you and would prefer to be with you, right? In the comments, we have healed relationships. Children need their parents. Families might be more stable. More teamed involvement for whole child approach. Yes, that is exactly what we want. Building natural supports. So often during training kinship families, they say they wish their parents in their life could access the training, especially around trauma and behaviors. Absolutely. Less placement disruptions. Absolutely. Perfect job, guys. Yeah. This would really be the goal, right? It would be to have a more successful reunification, that one that is safe, right? One that is not just the parent checking off what they need to do to frantically get their children back, right? Because parents who are checking off things on their list is amazing. We want that, right? Yay, they are doing the level of work that they need to do at times, but do they really understand the ongoing needs of their children? Do they understand that their children have higher needs? They have a social emotional compact that has been impacted when they have entered care. There's educational needs that need to be addressed, right? It goes beyond just the conversation of can this parent meet the child's everyday basic needs? Like that's wonderful, but kinship navigator programs would really be able to focus on as the whole child approach, as someone had mentioned, and that's what we want. We never want just the basics, right? Just like good enough for our kids. We should always be going further, and it's not even that big of a concept to go further for our kids, because we know that kids are not always going to remain kids. Kids are going to be young adults. They're going to be adults who are making really critical decisions in our community, right? And so we want them to have the best role models when they can. Reno's Life Change Center offers a strengthening families program for parents participating in their recovery program that helps families learn to heal together. I really, really love that. I also think that, when parents are in treatment or seeking treatment for either substance misuse or for mental health, I think that it's so important for their family members to also understand like what is treatment like, right? And our licensing classes can only be so long. Like for us to educate our kinship caregivers on what it's like to be an addict and then go into recovery and then have withdrawals and then to relapse, like that would take in a more immense amount of education and training. It wouldn't be something that I would expect someone to just, have an hour training on and walk away understanding. There'd be different steps in making sure that our families understand what it means to go through the process of getting treatment for substance misuse. And then what is it like to have a mental health illness? Like there's trainings on this actually, where you can have a more immersed experience on what it's like to have like schizophrenia, right? And of course, these trainings can't always be mandatory, but I think that it's so important for families to understand what their birth parents are experiencing. That empathy component alone can change. And it may not be appropriate for reunification, but it can serve the children a lot of good because it can still help the kinship caregiver to understand, like, okay, nurturing the connection between the child and the parent is so important, even if reunification isn't going to be possible. All right, let's dive into guardianship. All right, guys, so we're going to start our conversation on temporary guardianship. So going from less intrusive to most intrusive. Temporary guardianship, as you guys may already know, right? It is about, I don't know if it's different across your guys's, across states, but for Nevada, it is good for 6 months. It's usually a 1 or 2 page document. It is a agreement between the birth parent and the caregiver. It is signed and notarized, and it serves as just being temporary. Now, it is not the most stable permanency option, right? So when do you guys think that temporary guardianship is most appropriate? When would temporary guardianship be most appropriate? The parent is in the military. When the child is almost 18, homeless. When a parent needs to go to a rehab facility. Illness of parent. Yeah, I really agree with that. Military and illness of parents. Yes, absolutely. Whenever I think of temporary guardianship, I try to just think about it as, is there already like a private family plan that we know that the parents are going to return, right? So yeah, it would be maybe the parent is sick and is seeking health treatment, right? And we know that the treatment is going to be about somewhere between a couple weeks to a couple months, right? Totally fine. They definitely, could use temporary guardianship. Educational reasons, yeah, absolutely. That would be fine as well. There's lots of reasons why temporary guardianship is important. And then one thing to remember about temporary guardianship is it is on a temporary basis. So the caregiver would have to eventually seek out something more long-term if there is anything longer than 6 months involved. So sometimes with like parents experiencing homelessness or um just seeking treatment for substance misuse, all of those things could go longer than 6 months, right? And so if the guardianship 6-month period is over, that guardian would have to then be able to find the parent or contact the parent and renew it. And sometimes that can put a lot of our caregivers in a sticky situation if they are not able to find the parent again, which is why we say that within that 6 months, we know that mom or dad will be able to stabilize enough to have their kiddo come back into their care, right? So yeah, I mean, And then another thing is we have to think about older kids as well, which is not the biggest deal. But if we have kids who are 14 or older, they also have to agree. They have to provide their consent and sign, and that has to be notarized as well. So there's some limitations that we have to be able to assess when we're doing like temporary guardianship. And I want to make sure I don't miss any facts about this. And then we have to be able to consider the safety factors. What safety factors should we as professionals consider when we're thinking about or when we're talking to caregivers about temporary guardianship? What are some safety factors to consider? I think the time constraint on the guardianship is always my biggest worry when caregivers come to us and they talk to us about, hey, I have temporary guardianship. One of the things that I have seen that is sometimes detrimental to our children's well-being is how long ago the temporary guardianship expired, but the child remained with the caregiver. I don't know if you guys have seen that in across your professions, but it happens often here where we will get calls and, you know, the caregiver is pursuing legal guardianship and they had temporary guardianship and the child had stayed in their care for about a whole year now. So that is always one of the biggest safety things that we factor in. Also, the lack of resources available to temporary guardians has also been a concern. Sometimes when doctors' offices or even the school districts see the word temporary on a form, they are not likely to take it serious, even though it is a legal document, right? And they are still turned away from services, or grandparents or whoever has a temporary guardianship is still unable to access health care for their kids. Another big safety concern is that the temporary guardianship can become null and void at any time between even before the 6 months period, because the parents can tear up the piece of paper or say, you know what, no, I think I'm good on the temporary guardianship. I want my child back, and maybe they're still homeless, right? Or maybe they checked out early from treatment and never really completed their treatment. So there's a lot of different things to consider into temporary guardianship when we kind of are providing that education to our caregivers on what is temporary guardianship. All right, let's move into our conversation with legal guardianship. So legal guardianship, there's two different kinds of legal guardianship. So there is guardianship with KinGap, which is the guardianship assistance program, where the guardian will get a payment or a supplement or a financial aid to care for the child. I think someone had asked a question like this earlier before I hopped on here, but yeah, so this would be like subsidized guardianship, right? Where the caregiver has to be licensed for 6 months and has to be licensed for 6 months and has been in foster care, right? And then the other kind of guardianship is just the private arrangement where the caregiver is pursuing legal guardianship from their family court system to take on guardianships. So there's some limitations with legal guardianships as well. And there's some definite pros. What do you guys think the pros of legal guardianship is? And with legal guardianships, there's no time constraint. It could be permanent. Yeah, it could be an indefinite thing, right? Which definitely stabilizes our children. The child still gets a sense of permanency, absolutely. Ability to access resources, yep. The provider has economic support. Very good. Yeah, it does give, it is a good long-term option, especially for older children, right? Sometimes our kids will tell us like, hey, I don't want to be adopted, right? Like my parents are my parents, no matter what they're doing. I want to keep you as grandma, or I want to keep you as uncle. And I rather just have a guardian. And that is completely appropriate that a child can express their needs like that, right? And we want to honor youth voices in that. And yes, if they have guardianship with KinGap, they definitely have access to more resources and economic support. Now, for a caregiver who is pursuing guardianship independently, outside of the child welfare agency, they have access to welfare services here in Nevada. So that would be child only TANF. Our amount is, I wouldn't say it's terrible, but it's not the best either. I think it's just more so meant to be supplement income, right? So this is just supplement support for the caregiver. And so they have that. Now, if a caregiver is pursuing legal guardianship with the child welfare system involved under KinGap, here we can also have them negotiate to keep the Medicaid fee for service, which is really crucial and important for our kids who come from trauma and who have already ongoing therapeutic services that we wouldn't necessarily want to disrupt. For families who are pursuing legal guardianship independently outside of the child welfare system, we are able to help them access Medicaid, but it would be HMO plans, right? So maybe they'll have some out-of-pocket costs, but maybe they're okay with that, right? At least they don't have to pay a monthly premium or something like that. Sometimes though, that legal guardianship can be indefinite, and that can be not a great thing for caregivers. Sometimes I have caregivers that I have worked with for years, and they will call and they will, tell me very sadly that the parents are still not in the position to be reunited with their kids again, right? And that can be really challenging for caregivers because they have to keep holding on to hope that one day the kids will be able to go back home. And same for the kids as well. Some other limitations are, and I think that sometimes that this is a good thing, right? That the parents, when they are safe and when it is appropriate, they can actually pursue terminating legal guardianship on their own through a legal proceeding. And if they are able to do that independently, right, here in the courts, they will make sure to look into seeing if the parents are able to safely reunify, and it is going to be in the best interest of the child. And it is, the parents are finally stable. So they look into those things. So that's nice. We want that. And then for some implications for the family, one of the biggest challenges, especially for guardians who are doing this by themselves outside of the child welfare system, when they have to fill out court documents and make sense of the legal proceedings by themselves, right? And that's a challenge. They have to know how to fill out court documents, make sense of all of these legal terms. There's a lot of different steps to legal guardianship. And if it's missed, then they have to refile. So there's a lot of implications to the family. And if you have a family that's pursuing this independently on their own, it could be a real challenge. Change of the family dynamics as well as paperwork must be carried at all times. Yes. Post guardianship, there's still regulations for the caregiver to follow, and sometimes they may not remember, or they then have challenge again, right? In Nevada, and I think in other states, you have to be able to file a annual report on the child. And this is sometimes that's missed. I'm not sure if all courts remind their guardians to do this, right? Like we sure hope they do, but we get a lot of calls here and they're like, my annual's due next week, and we're like, oh God, okay, right? And so sometimes it's hard to remember all of the responsibilities that you're having to take on as the guardian. Now, let me ask you guys this. What does it take for a guardian to be successful as a long-term placement option? What does it take for them to be successful as a long-term placement option? We do get calls that caregivers are ready to terminate guardianship, right? It's not always the parents that are wanting to terminate the guardianship. Caregivers are ready to kind of have their life back and make sure that kids are going back home too. Follow all stipulations, keep up with the paperwork, the commitment, financial stability to care, to provide care. They have to be healthy and stable, keep connected. Absolutely, I like that. Having supports and services providers in place. Yes, all of those things. So there's also this big component that we kind of see in guardianship too, in order for guardians to be successful and the child to have the best outcomes in guardianship. So it is, if not father involvement, but some sort of good male role model, right? So if we want guardians to be successful and the child to have the best outcomes in guardianship, we want some sort of like father involvement or male figure involvement as well. The willingness of the family. So someone had mentioned commitment. So commitment is, very large there, because these are open conversations we should have with caregivers that, hey, like, legal guardianship, unless you terminate it or the judge terminates it or the parents terminates it, you're looking at this until the child is 18, right? And that's a really serious thing that sometimes caregivers don't always take into account when they're thinking about legal guardianship. Age and support networks when emergencies happen, mentors, yes, absolutely. The child's level of intellectual functioning. So one of the things I always encourage our caregivers to do during the legal guardianship process, or any sort of permanency process, is like understand your child's behaviors and their intellectual development and their social emotional health, like all of these different contributing factors, right? External problem behaviors. How much access do our guardians have to having like workshops to help them with managing difficult behaviors for our children that we see in our children? How much support and resource the guardian has in the following areas, such as their emotional well-being, the caregiver's emotional well-being, right? Their financial situation. And then all of these things kind of compounded together will be able to have the caregiver continue to provide on a consistent basis for the child. Now, one thing to really remember about guardianship and reunification is, for reunification, we focus heavily on reunification, right? And guardianship is also important, and we want the child to eventually still go back to the parents when it's safe to do that. And guardianship can still happen under guardianship. But studies do show that in 2020, about 149,000 children still re-entered foster care, even after post-reunification and post-guardianship. So when we are talking about these things and what makes it so crucial for us to focus on why providing supportive things in place, is because we want to limit those numbers of what we're seeing there. Let's jump into adoptions. So adoption is, of course, the most secure permanency option for children in care, next to a safe reunification. So I won't go through like the fast facts of it, because in our next session, we're going through forging a path forward. So we'll just consider some things about adoption. Is adoption, though very permanent and a wonderful, beautiful thing for a lot of our kids, they still have a lot of feelings. Our children have a lot of feelings towards adoptions. Birth parents have a lot of feelings towards adoptions. And then families who are adopting, especially kinship caregivers, they always ask us like, okay, well, we're adopting, but am I still going to be grandma, right? Those titles don't really change just because adoption has occurred. I want to make sure that we are giving us enough time to talk about our children and their feelings behind adoption. So I am going to hand it off to Trista, who will close us out on talking about the losses that kids still have in permanency.
Hey, you guys. So just to wrap up real quick, I'm going to spend the last 5 minutes of the day of this session just kind of talking about some of the things that come with a loss and permanency, right? Adoption, like Sasha was saying, is a really great experience, right? Provides permanency for children, but it also comes with its own set of loss, right? Children losing their mom and dad. And there's some risks here that we need to think about. You know, sometimes when we think of permanency, we think of a linear path forward. And for a lot of our children, this is not the case. We will talk about this a little more going forward in our reunification one presentation, but even when children are adopted or achieve, are somebody's given guardianship over them, the majority of the time, over 50% of the time, children go back and they seek out those relationships with bio parents, whether it's before they're 18, after they're 18, and pretending that this permanency option of adoption or guardianship is going to negate that relationship. Sometimes we're not doing our children the right service, because if mom and dad don't ever do the work to get better, we might be setting our children up to go back and seek out relationships with unhealthy people, right? We need to realize that this attachment will still probably continue, and that this relational permanency of having the relationship with mom and dad will probably continue at some point. So we have to keep that in our minds and teach our children constantly how to articulate those relationships, right? We don't want them to feel like they're being disloyal to us, or that they have to operate those things in secret. And we also don't want them to feel unprepared if mom and dad aren't healthy. So we might be teaching how to have healthy relationships with unhealthy people and really encouraging our children to continue communicating with us, even when they might be doing something that they feel like we wouldn't want for them. The other thing we have to think about is the guilt children feel here. Relationship building amongst families starts at the onset for children's benefit long term. They deserve the opportunity to accept or reject that part of their life. Parents can serve as another support. Absolutely, right? If we ignore it, the children are still going to do it. Right. And so we want to keep that in mind. We also want to keep in mind the guilt that children feel, right? Even if they're adopted or they achieve permanency, it's not lost on them that this whole scenario has happened because they're a child, right? If mom and dad didn't have any children, there would be no need for the child welfare system to intervene. And so even though us as adults can recognize that that's not their fault, children don't always internalize that. So we just want to make sure that we keep that in mind, because even though these permanency options are really joyful events, they do also come with some loss and some risk if we're not realistic about what that looks like. So I think that is a great way to wrap up our session. This last slide here that I just didn't click the button on, it says that 70% of those children that don't go home, they still reach back out to mom and dad, right? So I think I would just like to leave us on that stat. Before we go to break in like 1 minute, does anybody have any questions, comments, concerns, anything, feedback, takeaways? That is an excellent statement and a skill that our children in care can be helped to develop. Absolutely, right? Helping our children learn how to build those connections, whether it's healthy connections with maybe unhealthy people, or whether it's, just building really solid relationships. Those are great skills. All right, you guys, thank you so much for joining us for this session. We're going to go ahead and go on break real quick. I do see if grandparents adopt, they need to know if they receive Social Security, they might qualify. Absolutely. Those are things that Kinship Navigator programs and stuff can help with. We'll talk about that later. And then this has been great. Sadly, it's almost 5. Yeah, we know if you're on the East Coast, it might be getting close to home time. So if you can't join us, please check out the recordings. They'll be online. And you guys, we're going to go ahead and go on break. We'll see you back here at 2 o'clock. Allie's going to talk about forging a path to reunification. So thank you guys.